you said you were in college and the professors are, you know, watering down of, you know, this is good, this is bad, this is good. So that builds a perception, right? And so now you come out of college and you go in a certain direction. What are some of the myths about Heartland that that you learned that were just not true once you got in there?
The biggest question I get, the most common question I get from a dental student who's asking my advice now that I'm on this side, and was a myth that I heard, was that there is a quota or a certain benchmark you must meet for the amount of types of procedures you do. Like, is it true that you have to do a certain amount of crowns each month? And that is a myth. That is a lie. I don't even know where that formed. I imagine there must be a DSO that is doing that, or somebody created
Yeah.
that story. I don't know, and I don't need to ask. Don't even want to know. But that isn't what happens at Heartland Dental. That's one that comes up. You treatment plan what you think your patients need. You help your patient move forward with the treatment needs. And at the end of the month, you can see a printout of the work you did. And if I did 30 crowns at the end of the month, cool. 30 patients got the work they needed. Heartland will help me to get more patients to move forward with the treatment that they need. Like, they'll teach me how to get better case acceptance.
Yeah.
And maybe somehow that could be misconstrued as they want you to do more crowns. It's like, no, they just want you to treat patients and do the type of work you like to do.
Yeah.
And
And then
they'll
the way
help
I
you.
look at that, it's very simple. If someone's coming into your office asking for your expert opinion that you went to school for, you should be able to articulate that in the best way possible to give that individual what they need and what they're asking for, really.
And Heartland has taught us ways to help patients trust us, and taught, because not always do we come out of dental school with the right verbiage and the right body language and the
Yeah.
right questions. And Heartland teaches that. And they say, and doing these things will help you do more of the dentistry you love to do. Somebody could
See, that's
misconstrue
a
that and say, oh, they want you to do more dentistry. Nah, man, they thought
yes.
you wanted to do more dentistry.
Yeah, well, and it's interesting because when you go to college school traditional, they're teaching you the clinical side of things, right? But they don't teach you the business side of things,
Yeah, man,
right?
zero. I think I
So
got
Heartland's
one lunch and learn on business.
so what I hear you saying, and again, if I'm putting words in your mouth, please help me. But you got the college education for the clinical, and then now Heartland's filling in on the business side for you.
Not just the business side, but the people side. Because the business
Mm.
side, they do say you don't have to deal with that. We'll deal with that for you.
Mhm.
The how much collections to handle, what is the subscriptions you should be submitting to, what are the PPO plans? Like, they will handle all that for you unless you want to have hands on with it. But the people side, how to get people to move
I
forward with
love
the
that.
treatment you want to do. So it's up to you how much of the business side you want to take on. And that's kind of what I was getting at with, like, they will help nourish that desire. If you have it, they'll feed it and say, oh, you want to know more about business? Come on, why don't you come to one of the courses that we give to the office managers, even though you're
Mm.
the dentist in the practice. But back to the myth one, man, I just want to throw one more out. One more myth or concern some doctors have is that somebody will oversee your treatment plans. That there's like some like overseer or manager that looks over what you recommend. And that, in fact, was also a fallacy. When I signed up, I was like, who is this person that will oversee my treatment plans? And they're like, I don't know where you heard that, but we don't do that. We actually just let you do that here. I imagine it could happen if I would have been hired onto a practice that had an experienced dentist that worked there already.